Welcome to the special interview series by the COVID-19 Diary, where we discuss matters pertaining to infectious diseases arising all over the world, and also how to get the right information out there to help science journalists disseminate for you, our special audience. In this episode, I'm privileged to have with me Mr. Bernard Seytre to discuss the factors contributing to infodemics on SARS-CoV-2. You can bear with me that at the beginning of this current pandemic outbreak of the COVID-19, too much information, including false and misleading information, spread rapidly, especially on social media and digital platforms, causing confusion and risk-taking behaviors that could harm health, also leading to mistrust in health authorities and undermining public health responses. My guest today will help us identify contributing factors on this infodemic of SARS-CoV-2. My name is Imelda Amuji, and my guest, Mr. Seytre Bernard. Before we start, Mr. Bernard Seytre, please, I would like you to give us an introduction of yourself.
I am a health communication specialist working in public health. I have a company based in Paris, France, and in Lomé, Togo. I have worked for almost 2 years as an advisor on COVID-19 communication with the West African Health Organization. And I have published, I think, 5 articles on COVID-19 communication in sub-Saharan Africa.
Before we start, at the beginning of this current pandemic, COVID-19, too much information, including false and misleading information, spread rapidly, especially on social media and digital platforms, causing confusions and risk-taking behaviors that can harm health, also leading to mistrust in health authorities and undermine public health responses. And with this, I want you to help us understand the evolution of SARS-CoV-2 as a pandemic.
Meaning at the beginning of the pandemic, in January, February, March 2020, the African government took strong measures, prevention measures. They made decisions for lockdowns, preventing people from going around together, and so on. In some countries, the policy was very, very strong to prevent the epidemic. And then, really, people didn't see really an epidemic in sub-Saharan Africa. This is the point. So then it brought some people to ask themselves, but why these stringent protocols, measures, restrictions? And so this is an important factor, I guess, in the fact that some people lost their trust in their national authorities. But now there is something very new, is that 3 months ago, the first article appeared in the Lancet showing that, in fact, the epidemic in Africa is much, much, much higher than the official figure. And there was also another article 2 weeks ago published by a WHO team saying the same thing. So now we know that the situation of the pandemic is very different in Africa than what we thought up to a few months ago. What I have to say about this is that once more, unfortunately, public health in Africa is not strong enough. Because, more than 1 year ago, I would say 1.5 years ago, some articles were published showing that the level of people who had been infected at least once by the coronavirus was maybe 30%. And people like Médecins Sans Frontières, MSF, started saying more than 1 year ago, the infection rate in Africa is probably between 10% and 30%. And in fact, nobody launched at that time the studies that should have been launched to know what exactly the level of the epidemic was. And we had to wait until 3 months ago and until 2 weeks ago to have a WHO article saying the epidemic is much higher. But when I say it's much higher, it's 50 times higher. I'm not saying 10 times, 5 times, 50 times higher in some countries.
Okay.
So this is what I can say about the evolution of the pandemic related to the knowledge of the public, what people know about this pandemic.
Thank you very much, Mr. Bernard. Okay, so moving on, I want you to give us some examples of erroneous ideas that prevented public health measures to be applied.
Okay. If you don't mind, before answering your question,
Okay.
I will answer.
Okay.
I'm not going to be a politician, not answering the question, but
Okay.
I would like to talk about something else. I mean, not something else, but I would like to point out that erroneous ideas are very frequent in public health.
Okay.
And that is not the first occurrence.
Okay.
During my teaching and training of people who are working in health on the field, I devote half a day or 1 day giving examples of wrong ideas, fake news, we say today, that went around about public health questions. I will take just 2 examples. One is that in 1990, in Cameroon, the government decided to vaccinate all the young women, women in age of bearing a child, to vaccinate them against tetanus. Only the women and the men. Why? It was a way to protect the baby, because when the babies are born, they can get tetanus. But if the mother had been vaccinated, the babies are protected by the antibodies from the mother. So there was a huge vaccination campaign aiming only young women in age of bearing a child. And then a few years before, the same government had made big campaigns to prevent birth, to limit the birth rate. Telling women you should have fewer babies. And then when this vaccine arrived, given only to the women, a young woman, people thought, okay, there is something wrong in this. And they thought it was going to sterilize the women. And there was a huge movement, and the government had to give up the vaccination campaign. This is just an example. A second example. In 1988, 34 years ago, it's a lot of time, 34 years ago. You were not very young at that time. I don't know if you were born. I was not born.
I was not born.
So it's a long time ago.
Yes.
WHO decided to launch a campaign to eradicate poliomyelitis. And the goal was to get the eradication by year 2000. 22 years ago. And the eradication has not been achieved. Polio is still around. And why? For one reason, because part of the population opposed the vaccination because of resistance in part of the population. Because once again, same thing as with tetanus vaccine, people thought it was a way to sterilize the population and to limit the population. And these rumors about the polio vaccine being a way to sterilize
Okay.
The population went around in two very different areas in the world, areas with no connection. And at that time, there was no internet.
Okay.
20 years ago, it was just the beginning. So these two areas were northern Nigeria, in Africa, of course, and a part of India, Pakistan, and Afghanistan.
All right.
And in these two regions, these rumors arise for the same reason, because people there, Muslim, most of them, often poor people, were opposed to the central power that was more Catholic in Nigeria or Hindi in India. And so there was a religious and ethnic conflict that was the basis for the opposition to the vaccine, polio vaccine. So you realize the eradication was supposed to occur 22 years ago, and that's not occurred because of the opposition. So this is what I wanted to say. I wanted to say that erroneous ideas, rumor, preventing a public health campaign to be effective is something quite common. Okay, so it's quite common in two cases.
Okay.
First, a new disease.
Okay.
Because people don't know it and they have to understand it, and they might be scared. And okay. And second, a new vaccine. Tetanus vaccine was a new vaccine in Cameroon at that time I was talking about. The polio vaccine was a new vaccine in all these areas where the resistance appeared. And today, of course, the COVID-19 vaccine is a new vaccine.
Yes.
So now if we want to talk about erroneous ideas around COVID-19 and infodemics, okay, of course, a lot of erroneous ideas have been circulating. Today, we are in the 21st century, and they circulate on the internet, not only on the internet, but also on the internet. And on the internet, they circulate very quickly.
Yes.
But before, they were circulating too. As I said, about polio, about tetanus, and so on. Wrong ideas were circulating, and quite quickly too. Not as quickly as today, but quite quickly too. So what I want to point out is that what we call the infodemic, meaning the circulation of erroneous ideas on the internet, is something new just by the speed at which it circulates.
Okay.
Yeah?
Yes.
It's not fundamentally different. Okay, I took only two examples of other erroneous ideas, but I could have taken dozens of them. Okay.
Yes. Okay.
And another point I want to make, and that I think people don't make enough, is that on the internet you find wrong ideas, but you also find good ideas.
Yes.
On YouTube, you have people telling that Bill Gates is inoculating microchips through the vaccines. But on YouTube, you also find your videos, the videos you put on YouTube that are nice videos with interesting information.
Yes.
So I mean that people on the internet, they can find right information, a lot of right information.
Yes.
That they were not able to access before. Today, when you go anywhere in a remote area in Africa, you go in a village, you have people with their smartphone.
Yes.
And they can watch TV news from reliable channels.
Yes.
Also, they can watch stupid videos. So, I mean that the internet is also a way to circulate good information. Now, the real point is, why do some people look for, not only believe, but look for wrong information? And why do others choose the right ones.
Yeah. Okay.
I don't know.
Yes, you've done justice to that. Okay, moving on. I want to know. I know that the main point is not about the fake news by themselves, but the fact that are people ready or not to believe those informations?
In France,
Okay.
my country,
Okay.
people are exposed to the same social networks.
Okay.
All over France, of course. Well,
okay.
Now, we have some territories that are far away, that are in the Caribbean, in Central Africa, that are French departments, French territories.
Okay.
In mainland France, 80% of the people are fully vaccinated, have at least 3 doses. 80%. We have the highest rate in the world, or one of the highest rates in the world. Okay. Now, in the French overseas territories, it's very, very different. Okay. In the Caribbean, okay? In Martinique, 40% only are vaccinated.
All right.
In Guadeloupe, 37%. And in Guyana, 30%. 30% versus 80% for the whole population. And they are exposed to the same infodemics.
Oh, okay.
So now, why do people in Guyana, Guadeloupe, and Martinique believe more these fake news than in Paris, Lyon, or whatever in mainland? Okay. Yes. This is a real point. And the point is that in this territory, there is an opposition to the central government based in Paris. Okay. These people have often been in opposition. Okay. And you know, a French philosopher that is world famous, that is Michel Foucault. Okay. Talked and wrote a lot about what he called the biopower. Okay. I mean, the power of the government on the health of people. The biopower is the power for the government to provide health to its population. Okay. If the COVID-19 vaccination is part of this biopower. Yeah. For example, in Africa, people rightly, and I support them, say that there are not enough vaccines. It's kind of the biopower of the North to have the vaccine, and I think the North has to provide it more to the South. Yeah. Now, if there is a biopower, I say there can also be a bio-opposition, political opposition. Yes. Meaning, if the power, the government tells the people, look, we are giving you vaccines against COVID-19 to protect yourself, your children, and so on, that is, of course, political. Okay. But then there can be a bio-opposition, people who are opposed to the government who say, I don't want your vaccine. Okay. And I want to give another example in the US. Among the Republicans, 60% of the people got one shot of the vaccine. Okay. I'm talking about one shot only. 60% of the Republicans. Okay. Among the Democrats, it is 86%. Okay. 86%. And now if we go only among the white people in the US, the white Americans. Okay. Among the white Americans, 90% of the Democrats got at least one shot. And 59% of the Republicans, 59%. Why? Because of Trump policy. And they are exposed to the same infodemic about the vaccine. But when the president himself says what Trump said, I'm not going to repeat what Trump said. Okay, so this is the result.
Okay. Thank you very much, Mr. Bernard Seytre. We would like to go for a quick break. When we come back, we'll continue with our session. Welcome back, viewers, and welcome back, Mr. Bernard Seytre. on this session, we are going to have a presentation and you are going to let us know some of the risk information you got out of some research done in some countries in Africa about how one can get coronavirus. So you will help us understand and the reason why some people have some perception in those parts of Africa and their exposure to those kind of information. Thank you.
Okay, thank you. Then we conducted a study in 5 West African countries, Cabo Verde, Guinea-Bissau, Ivory Coast, Burkina Faso, and Sierra Leone on COVID-19 representation. And we studied some of the erroneous ideas that we know were people were likely to be going around. And so if you can see the first slide, we ask people who can transmit COVID-19 to you. Then first, remember, just one point to be remembered, that COVID-19 is only transmitted from one person to another person. It's not transmitted by any other way, And then we discovered that if you look on the right of the slide, 90% of the people, 90% of the people knew, the green bar, that somebody who is sick can transmit the virus. But only 20% on the left of the slide, only 20% of the people knew that somebody who is not sick can transmit the virus. This is a problem because 80% of the transmission in Africa is by people who have no symptoms of the disease, who are not sick. And what was surprising is that if you look at the other bars on the screen, you can see that 24% of the people think that eggs can transmit the virus. And for example, 26% that domestic animals can, 28% that fish can transmit the virus, and so on with wild animals, and 38% think that raw meat can transmit the virus. And this is completely erroneous. So if we look, if you can go to the second slide, if we make a comparison between the countries, between the 5 countries, we can see that the level of belief in these erroneous ideas is very different from one country to another country. For example, is striking about eggs. In Sierra Leone, only 1% of the people think that eggs can transmit the virus, while this level is 43% in Guinea-Bissau. If you look for fish and meat, same thing. In Sierra Leone, very few people think that fish or meat can transmit the virus, while this level is much higher in the other countries. Now, if we go to the next slide, here we compare the same data as just the slide before. We compare this data to the level at which people heard a message about this, a message with some of these erroneous conceptions. So the blue line is the percentage of people who heard some messages, for example, about eggs transmitting the disease on the bottom right. And you can see that for in each of these 4 charts, there is a correlation between the level at which people heard erroneous ideas and their belief in these erroneous ideas, meaning that these erroneous ideas don't come from something cultural. People heard them. And now if we go to the next slide, here I put some posters on the top and the bottom 2 short screens, screenshots, excuse me, 2 screenshots from videos from WHO Africa. And you see that these messages say, avoid contact with poultry, pigs, don't eat uncooked meat, eggs, and so on. And don't eat bushmeat.
Yeah.
These messages were disseminated from WHO Africa and disseminated in some countries, but not in all countries. This is the point. In some countries, the Ministry of Health said, okay, this is wrong, we are not going to use this message. But in other countries, these messages were used. And this contributed to propagate wrong ideas. So I have to say that I made a publication on this. It's written on the bottom right of the screen. I published an article in June 2020, and 2 weeks after this article, WHO changed his web page and removed all these erroneous messages. The point I want to make is that 1.5 years later, when we, no, not a half, 1 year later, when we made a survey, these ideas were still going around in the population. So I want to emphasize that when we work in health communication, in public health communication, we have a responsibility not to share, to disseminate erroneous ideas. And this is, I mean, it's not the first time it arrives. It happens in public health. Just I wanted to point this, because a lot of people talk about fighting, looking for erroneous ideas. But first, we should look at ourselves as public health communicators. Are we sure we have always propagated only right ideas? And if you tell people that through eggs they can get the virus, it means that they are be less cautious about human-to-human transmission. Or we have to concentrate on the true transmission. This is a point I just wanted to make.
Thank you very much, Mr. Bernard. Moving on. When this pandemic started, we had a lot of information on social media stating that some factors could contribute to the transmission and the incubation of this virus, such as the diet, hygiene, isolation, and climate. I want you to help us. I know with this statement there are some percentage of truth in. Help us understand how climate, hygiene, and even our diet can help or have no input in the transmission and incubation of this virus.
Climate has an impact in the transmission of the virus. Of course, we can see it in the north. It's more during the winter that the virus goes around. I say it's more. It doesn't mean that during the summer there is no disease, because there were waves that started in June, in July. So it's not it doesn't mean that in the winter, in the summer, there is no virus going around. It means that the epidemic seems to be higher usually during the winter, but maybe because not because of the climate, but just because during the winter in the north, people live more inside the houses. And they close their windows. And this facilitates the transmission. So it is indirectly the climate.
Indirectly.
Because if you're outside, the risk of transmission is much lower. So now diet and so on, nobody has shown that it could impact the transmission.
Hygiene.
So the hygiene, yes, of course, if you wash your hands, but you know, in 2020, when people were really taking care of washing their hands, the influenza epidemic was much lower than the years before. So washing your hands prevent the transmission of the coronavirus, but of a lot of diseases. And the influenza epidemic, the 2 last years, was lower than the years before because of the protection measures against the coronavirus. So washing hands is always good.
Isolation.
Isolation, of course. If you
Yes.
are in isolation, you have less transmission, fewer transmissions of the virus. But what I would like to say is that during our study, what people told us, and other studies show the same thing, not only ours, is that I don't know anybody who got COVID-19. In my neighborhood, my community, in my family, I don't know anybody who got the disease. Wow. So, is the disease really in the country? If I watch French TV, British TV, American TV, I can see, and people do it on YouTube. Okay, a lot of people watch the news from foreign countries a lot on YouTube. Maybe less in South Africa than in other countries, but so they say, okay, on French, British, American, Brazilian TV, I can see images of dead and sick people. On our TV, I don't see on any of these images. And in my neighborhood, I don't know anybody who has COVID. So I think COVID-19 exists, but not here, not in Burkina Faso, not in Ivory Coast, not in Sierra Leone, not in Cabo Verde, and so on. A lot of people are dead. Okay. And this is the main point, because if we are talking about vaccination, yourself, myself, anybody, if we get vaccinated, we make our own evaluation of our benefit-risk ratio. Okay. When the vaccine arrived, at the very first time, when the first vaccines were administered to people, myself, I said, okay, let's see if this vaccine is safe. It is a new vaccine, very quickly developed. Is it safe? Is it effective? And we saw that it is safe, and we saw that there was a huge decrease in the number of sick and dead people. Then I thought myself, okay, I'm going to get vaccinated, of course. And everybody does this. Even a farmer who cannot read and write in a remote area of Africa thinks the same way as I do and you do. What is my benefit-risk balance of getting vaccinated? Now, if you think that the disease is not in your country, why to get vaccinated? Okay, the French get vaccinated, right for them, good for them. The Spanish, the British, the Americans, good for them, because they have the disease in their country. But if I don't, if I'm not exposed to the disease, why should I get vaccinated? And this is the main point. This is the wrong idea we have to fight, is that we have to show the people in Africa that the disease is around, and even more than what we thought before. And if you don't mind, I will give you some figures. An article was published very recently with more accurate figures. In sub-Saharan Africa, the official figure was that 150,000 people had died of COVID-19. 150,000. Wow. The actual figure is over 2 million deaths, meaning 14 times higher. Now, if I go to some countries, South Africa, you would be interested in the figure in South Africa. In South Africa, the official figure was 91,000. The actual figure is over 300,000, 3.3 times higher. Now, if you go to other countries like the Democratic Republic of Congo, the actual figure is 82 times higher than what was thought. If we go, for example, to French-speaking countries like Senegal, it was thought that fewer than 2,000 people were dead, died of COVID-19. The actual figure is almost 40,000, 20 times higher. If we go to Nigeria, the largest, the most populated country on this continent, the official figure was 3,000 deaths, and the actual figure is 163,000, 50 times higher.
Whoa.
Okay?
Yeah.
And this is the reality of the disease. And I think the wrong idea going around on this continent is that COVID-19 is not a threat for ourselves. And this is the main idea we have to fight against if we are working in public health communication.
Thank you very much, Mr. Bernard Seytre. On this note, I want you to give us your final words before we leave our audience.
What I want to say is that WHO summarized in 4 points what should be done against infodemics. It is, first one, listening to community concerns and questions. Second one, promoting understanding of risk, I just talked about. Third, building resilience to misinformation. And fourth, engaging and empowering communities to take positive action. If I want to summarize these 4 points, what does it mean? It means that the only way to fight against infodemic is to develop a good communication. A communication based not on what we have in our mind, but based on the real representation, the health literacy of the population about COVID-19. So what we have to do is to study the level of health literacy among the population on COVID-19. And we have to start from this to develop a communication filling the gaps.
Thank you very much, Mr. Bernard Seytre.
Thank you for the time. Thank you for the time you gave me.
Nice having you, and I hope to see you on more of our programs at AAU TV. Thank you, lovely viewers, for your attention and time. This brings us to the end of our discussion on the factors contributing to the infodemics on SARS-CoV-2 with Mr. Bernard Seytre. If you just joined, you can watch this discussion on our social media platform on Association of African Universities on Facebook and YouTube, and on our dedicated website at tv.aau.org. My name is Imelda Amuji. See you on the next discussion series on the COVID-19 diary.